Women have unique health issues, however, many don't discuss these issues with their doctor because they are not aware that there is help. After childbirth, 30% of women leak urine at 3 months, 50% will prolapse, and 67.2% have a correlation of cesarean scar and chronic pelvic pain.
So after having the baby, obviously going through such a traumatic experience, my body has changed a lot. Being 7.5 months postpartum, I'm still learning what my body is capable of doing, going through that process.
Issues from pregnancy and childbirth impair thousands of women each year and can have lifetime consequences. After childbirth, 36% of postpartum women experience pain with sex. 25% of women leak feces at 6 months, 40% of women have diastasis at 6 months, and 40% of women involuntarily pass gas during sex at 6 months.
I expected it to all be away, it was done with, I've had the baby, and it's still there, but with therapy and, all this stuff, it's working.
Issues after childbirth occur both in vaginal and cesarean delivery. It's common for women to suffer with urine or bowel leakage, chronic constipation, pelvic and back pain, core weakness from diastasis, that's when the belly splits and doesn't grow back. Many experience pain with sex or experience sex differently. Some women end up with a flared rib cage from baby being under there. Over time, they feel unable to take a deep breath. Women do not report these issues to their doctor because they're not aware that there's help.
It's never too early or too late to seek treatment. It is possible to feel like a natural woman again. Early contact decreases the risk of long-term pain and dysfunction. Risk of urinary incontinence increases after delivery. 50% of women continue to experience urinary incontinence at 1 year postpartum and 10 to 29% at 4 years. 25 to 50% of women experience pelvic organ prolapse during 1 year postpartum. 8% of women report recurring lumbopelvic pain shortly after pregnancy, 13% after 1 year postpartum, and 8 to 20% at 2 to 3 years.
Normalization of postpartum dysfunction in our culture leads to underdiagnosis. The American College of Obstetricians and Gynecologists recently acknowledged gaps in postpartum care and updated recommendations to include rehabilitation as a part of maternal recovery from birth. Rehabilitation should be considered at any time after childbirth if your body feels different. Most women come to therapy after 6-week follow-up, but many come months and even years after realizing they have a childbirth injury that can be rehabbed. The joints of the pelvis become more unstable after delivery and don't always find their way back to alignment. In therapy, we see many women with pelvic pain and instability that started after childbirth. We align the pelvic bones, teach proper exercise and movement methods to regain pelvic stability and function. This means women can have more flexibility and movement without pain.
Women with children lead very different lives and have unique needs that are often neglected because they are responsible for home, family, and work environments. After childbirth, the baby becomes a crucial focus.
Friends and family often forget to ask how mom is doing because they are so excited about the new baby. We need to teach moms to prioritize their physical and mental health after having a baby. Having a child is one of the biggest occupational transitions in a woman's life. Adjusting to this change is essential for transitioning towards optimal lifetime health. 6 weeks postpartum is only the start of your women's health journey. Pain and dysfunction should be addressed at the 6-week follow-up appointment. The more babies you have, the more at risk you are for injury and dysfunction.
Definitely take care of your body before pregnancy and after pregnancy. I didn't know, like I said, that there was any cure for it until I had the baby and I was like, man, I'm really hurting. I don't like my body. And then I came here and it's all good.
Women who are returning to exercise are at increased risk of injury. The higher level athlete, the more prone a postpartum woman is to injury after childbirth, including prolapse and pelvic pain. Athletes are experts at ignoring pain, which makes the risk even higher.
There was not a lot of education or information that was provided to me about having a baby and being an athlete or physically active. But with my background, I did a lot of research because I just wasn't sure. And I knew, like I said, I was going through a traumatic experience. So I wanted to make sure that I would heal my body properly before getting back into what I love. See a pelvic floor specialist prior to being postpartum. The experience that I had has definitely helped lead me to be an even better athlete than what I was before. I'm learning more body awareness. I'm learning how to connect my breathing to my body movements. And it's really helped me just all around be better.
Whether women have major or minor issues, it is important to discuss them with your doctor and seek therapy.
The goals for each woman in therapy are different because each woman has a unique history and demands of her body. Some women's goal is to not leak urine, while other women want out of pain. There's many dysfunctions that can occur from childbirth injury. Scheduling a therapy evaluation will tell you what changed in your body, what needs to be addressed, and how to approach it.
From the first moment that I started coming here to the urine control, we noticed how tight my muscles were and trying to stretch them out. It was amazing. I could notice first off that I could start moving more. I could do more things, and then it expanded to different things, discovering more about what I needed.
We are able to tell you exactly how your body responded to pregnancy and delivery and how to rehabilitate it. However, you must decide to take control of your body after childbirth.
Coming here, I had the chance to actually have a full exam and find out all the other things that were going on. I had no idea with the other therapists. I just didn't realize what was going on. I thought I was going in for pelvic floor therapy, but coming here helped me see that there was so many other things going on that they could help me with. And I've had relief from a lot, like helping me with stretching the perineum for delivery and kind of relieving some of that pain that again, the sciatica wants to kind of flare up occasionally. We need to work on that. And it comes and goes in weird ways. Sometimes it's muscular, sometimes it's a baby. You can't really do anything about it, but it's been good in those areas.
Decide to take control of your body after childbirth. Talk to your provider about therapy and make an appointment so that you can feel like a natural woman again.
I didn't know there was therapy for this.
I didn't know there was therapy for this.
I actually did not know that there was therapy for this.
I did not know there was therapy for this.